to say, this is not I had a decade ago. I think we got to start with universal health care, and then we got to actually focus on bringing down costs, because all we do right now is we argue about expanding coverage, contracting coverage, and yet costs continue to rise. Somebody who's also been a leader on this, who I'm spending a lot of time with on another issue these days, my dear friend, Senator Catherine Cortez Masto.
Thank you. First of all, thank you, every single one of you, for being here and doing what you do. It is so critical now more than ever. So many people are in need of health care. And some don't need it, but they should have just the insurance of it, right? And that's what this is about. And it should be affordable. We should have quality health care. It should be affordable. You should have access to the medicine when you need it. That's what this country is about, right? I would also assume, and maybe I shouldn't, but we also know that it's not perfect. And there are reforms that need to take place. I think we all agree that, listen, if we can improve upon it, and we can also address the fraud, waste, and abuse. Of course, we can do all of that without taking health care away from those who need it. And so, Ms. Bush, let me start with you. Mm-hmm. The individuals that you're talking to are the people that actually need access to health care, correct? Who are you hearing from? You're not hearing from the fraudsters. You're not hearing from people that are taking advantage of the system. What you're hearing from the people that actually need it.
Yes.
And who are they? Can you describe them for?
They're the clients.
Mm-hmm. And what do you hear from them? What are they telling you why they need health care, if any?
They need health care to stay alive. Mm-hmm. You know, they have critical issues, you know. They may have strokes. Some may have heart attacks, you know. So they need that insurance.
Right. And what I hear also back home is there's a lot of working parents who need it for their children who have a rare disease and they can't afford health care. Is that right?
Yes.
That's right. And so there's so many of those folks out there that's what this is about. And that's what this fight is for. Let me, Ms. Gasteyer, let me ask you this, because Massachusetts, like Nevada, has a state-based ACA marketplace. Is there any unique administrative challenge that a state-based marketplace is facing as we delay extending the enhanced premium tax credits, or we don't do it at all?
Yeah, I would say, you know, right now we're in the middle of the most complicated open enrollment period we've ever had to prepare for and execute because of the uncertainty about the future of the enhanced premium tax credits. So we've had to communicate in complex ways with the hundreds of thousands of people that we serve to make sure they understand how federal changes, or inaction in this case, is shaking out in their premium increases. We are ready operationally to effectuate an extension if that does come through, but just that general uncertainty is certainly an administrative and operational challenge. People's lives that depend on marketplace coverage, they're really looking for stability, and so too are the organizations that provide people care, you know, at home or through nonprofits. Across the board, Americans are just looking to be able to count on their health coverage to be there for them when they need it. It's a very simple ask. And those of us who are on the front lines trying to provide that coverage are looking for that certainty as well.
Yeah, thank you. And then one final question I have for you, Ms. Keith. Recently, two of my colleagues, Senators Crapo and Cassidy, just introduced an ACA reform proposal that replaces the enhanced premium tax credits with a health savings account. Do HSAs actually give people the same immediate relief from high monthly premiums that the enhanced premium tax credits do?
Absolutely not. No. HSAs are in no way a substitute for the enhanced premium tax credits or even comprehensive health insurance that people really and truly need. As mentioned, I think what consumers want is lower costs, less complexity, and better coverage, and HSAs fail on each one of those metrics. It does nothing for premiums to lower premiums. There was an example earlier from Vermont where you can see just how much these premiums would be going up. They incentivize high deductible health plans, so deductibles would get higher, out-of-pocket costs would be greater for consumers, and it would add complexity where consumers are already overwhelmed by all the choices and options that they have to navigate. So HSAs would do nothing about the current premium affordability crisis and, in fact, expose people to much higher out-of-pocket costs.
And let's just say, for example, maybe the proposal was a good idea. It really isn't, but it needs work. Let's say it was. Would it do anything right now to help those people who are falling off the cliff immediately in the next year?
It definitely wouldn't do anything right now. It would need to be administered. I would also add that HSAs are not even new for marketplace plans. This is an option that some people have already, and even for 2025, only 2% of consumers opted for an HSA eligible marketplace plan. Consumers are not enrolling in these products, and I don't think it's even that surprising why. This is not a population that has cash lying around to put into a tax-preferred savings account to fund out-of-pocket costs. And you see what consumers want is more generous silver and gold coverage. So this is, in many ways, I think, a solution in search of a problem when the real issue right now is the premium affordability crisis that millions of people are facing.
Thank you. Thank you, all of you, for being here.